I'm Dr. Cecil Bennett. I am a family physician. I feel it necessary to speak out due to my concern regarding the plan for the distribution of the COVID vaccine. I am concerned because the plan I've heard so far for distribution of the vaccine seems to be very similar to the plan deployed at the beginning of the pandemic for testing. That said, everyone who wants a test will get a test. That did not happen. Then the plan changed to everyone who needs a test will get a test. That still has not yet to happen, now 9 months since the start of the pandemic. President Truman once said, "The only thing new is a history we do not know." Did we forget not just the history from 9 months ago, but just from yesterday, with cars lining up in parking lots and people waiting for hours to be tested? At the time, the COVID testing plan called for the training of new workers, setting up tents, and having results back in 24 to 36 hours. By any measure, that plan did not work. 9 months later, the lines are still long in many places. Results in some places take over a week, and only about 200 million people have been tested in the last 9 months. To get to herd immunity, where we have to get to, about 250 million people will need to be vaccinated twice 1 month apart. That's 500 million doses in a 6 month period if all goes well. And what is the plan we've heard so far, or announced so far? Train new healthcare workers and set up tents in parking lots. The plan for the vaccine distribution seems to be the same failed plan for COVID testing, with one exception. Minnesota would go from this last summer for COVID testing to this in the months to come for vaccine distribution. I am sure that President-elect Biden and his COVID advisory team would not want the memories of Americans during his first month in office to be images like this. Let's look at what is necessary for a successful vaccine campaign. First, you need an effective and safe vaccine. Next, an organized, knowledgeable, and credible medical team. We also need to know who to vaccinate first, second, third, and so on based on CDC guidelines. Having vaccination sites in all parts of the country, from the poorest areas to the richest areas. Having the ability to collect data and alert patients in a timely manner that their second dose is due. Control the cost of distribution of the vaccine, stay on budget. And finally, delivering the vaccine in a timely manner. Everything I have described for a successful vaccination program can be accomplished by one division of healthcare, primary care providers, to include family physicians, general internists, pediatricians, and OBGYN. Our group comprises over 300,000 physicians. We are organized, knowledgeable, and credible. Our patients know and trust us. There's no one better than us to cut through the politics, fears, and conspiracy theories about vaccinations. Because we have years of relationships with our patients, knowing who to vaccinate first, second, third, etc., is very easy for us to accomplish. We practice in all parts of the United States, from East Coast to West Coast, and in all neighborhoods, from the most underserved to the most affluent. We use electronic health records so we can easily track data, vaccinate individuals, and bring them back in 30 days. Billions of dollars from Washington would not be necessary. The vaccines are provided. The average reimbursement from the federal government and commercial insurance is about $20 for the administration of the vaccine, so not expensive at all. I hear that the initial budget for vaccine deployment by the federal government is $8 billion. Let me say something about that. When I was a medical student, if you had somebody who was an alcoholic, whatever amount they told you they drank, we were told to double it. When it comes to the federal budget, whatever amount we're told that a program will cost, you triple it, and then you double it. Finally, as far as delivering the vaccine in a timely manner, based on our current daily flow of patients, the average PCP can vaccinate 1,000 patients in 2 months. 300,000 providers times 1,000 vaccines means 300 million Americans vaccinated in 2 months. 300 million Americans getting 2 doses will take 4 months. Let's look at a typical visit with your family doctor. It's good to see you today. How's everything going?
going kind of slow, moving a little slow these days.
I need you to also know that the new COVID vaccine is available and we're recommending it to our patients. What are your thoughts about that?
I'd probably have to think on that a little bit. I don't get a little more information. I'm not too quick to take vaccines.
Why is that?
I guess I don't really believe what the government puts out. I don't trust them. I don't trust a lot of things read. Man used to say, only believe half of what you see and nothing you read. So
Okay. Are you concerned about the safety or the effectiveness of the vaccine as
Yes,
well?
sir.
I understand there may be some, concern about safety and efficacy.
I've read on the internet about conspiracy theories. They plan on putting stuff in there to track you and all that kind of stuff, but I don't know. I just don't know.
Okay, well, how long have you been my patient now, Walter?
About 17 years, I believe.
Okay, so we've been friends for that 17 years, or you and me coming back for the 17 years. And during that time, I've always tried to let you know what are the benefits and the risk of any type of treatment option. And I always hope that you realize I do whatever I believe is best for you.
I do believe that.
All right. Now, when it comes to the safety and effectiveness of the vaccine, you should know that the vaccine is very safe. In the clinical trials that have taken place over several months now, the vast majority of patients have had no significant side effects. If any significant side effects would develop, it's usually within the first 6 weeks, and we're well beyond that window now, and so far the vaccines have proven to be safe. The next issue, as far as efficacy, greater than 90% of the patients who've had the vaccine are showing immunity to the virus, so that's very good. When it comes to conspiracy theories, there's a lot of stuff that you can read on the internet, but I hope that you would more trust our relationship than what you actually read on the internet.
I would.
So given what we just discussed, do you believe that this is something you would do today?
If you suggested it, I would.
Okay, well, I appreciate that. So we'll go ahead and get Mildred, we'll give you your vaccine. Know also that we're gonna record the vaccine in the electronic health record, your first dose today. In about 30 days, we'll bring you back for your second dose. We'll get an alert to know that you need to come back, and we'll record that second dose as well. That way in the future, we have documentation of when you actually received the vaccination, okay?
That sounds good.
All right, good to see you. I'll be back in after Mildred gives you your vaccine.
All right, so thank you.
Good morning, Ms. Edson.
Good morning.
How are you this morning?
Doing fine. What about yourself?
I'm doing great. We're gonna put this in your left arm, okay?
There is no need to stand in long lines at a pharmacy when the vaccine can be administered during routine office visits.
Okay, we're gonna roll up your left sleeve, and this goes in the muscle.
Is that high enough?
That's high enough. Okay. Okay. You're all done.
Thank you, ma'am.
You're welcome.
A special thanks to my patient and friend Walter Edson and my medical assistant of 18 years, Mildred Vaughn. We gave Mr. Edson his tetanus vaccine, by the way, was not the COVID vaccine. Getting this done does not require a military special operations. It just requires respecting the value of PCPs and giving us the space to do what we have been doing for the last 100 years, serving our patients. Family docs don't get TV shows like ER doctors and surgeons do. We're considered to be boring. We don't do drama, we do relationship. We don't do excitement, we do encouragement. We don't do politics, we do prevention. Mr. President and Mr. President-elect, this is the help America really needs to get back to normal. Please pick up the phone and call my friend, Dr. Ada Stewart. She is the president of the American Academy of Family Physicians, representing 130,000 physicians from the East Coast to the Midwest to the West Coast. Most of us didn't go to Harvard or Yale. I went to Syracuse for undergrad and Morehouse School of Medicine for medical school. Over 25% of us were not born in the United States. My parents are originally from Jamaica. All of us chose primary care because we cherish long-term relationships with our patients, and we understand the importance of disease prevention. So please, send the vaccine to the state governors and have them send the vaccines to us. We'll take it from there. Sometimes the best plan for a complex problem is the simplest solution. Primary care physicians.